Hello everyone and welcome to our recorded lecture on pediatric neurology. We'll begin with a short review of the anatomy and physiology of the nervous system. As you remember, the nervous system is split into two different systems, the central nervous system, or the CNS, which consists of the brain and spinal cord, and then there's the peripheral nervous system. The brain itself is subdivided into lobes: the frontal lobe, temporal, parietal, occipital, and cerebellum. And there are also meningeal layers, and this will be important later when we talk about different kind of head bleeds. The sympathetic nervous system is responsible for the fight or flight response, which consists of norepinephrine and epinephrine being released into the circulation, causing an increased heart rate, decreased peristalsis, and redistribution of the blood to the peripheral muscles. On the contrary, the parasympathetic nervous system is responsible for relaxation. Acetylcholine release from the PNS results in bradycardia, hypotension, better gastric mobility, and pupillary constriction. You also have the blood-brain barrier, which is composed of endothelial capillary cells, the blood-CSF barrier, which is established by the choroid plexus, and finally the CSF-brain barrier, which has ependymal cells. On the left, you can see the blood-brain barrier illustrated, where you see the capillary lumen in the middle and the tight junctions between the endothelial cells. And then you can see a microscope image on the right. You also have ventricles in your brain. This system is composed of two lateral ventricles, which then connect to the third ventricle and drain down into the fourth ventricle. CSF, or cerebral spinal fluid, is produced by both the brain itself and the choroid epithelial cells. The primary purpose of CSF is to provide a supportive, buoyant environment for the brain. As you can see here, this is an illustration of the CSF flow within your brain. At the top, you have your two lateral ventricles, and the CSF flows down through the third ventricle into the fourth and all the way down into your spinal cord. Cerebral blood flow is the term used for the blood that gets pumped to the brain. This provides the necessary oxygen for your brain to work. There are many different things that control the cerebral blood flow, such as blood pressure, carbon dioxide, and oxygen. One of the newer ways that we can measure cerebral blood flow is using a NIRS system. Basically, a NIRS system is a pulse ox that you put on your forehead that can detect how well perfused the brain is underneath. There are many different diagnostic procedures that we use in pediatric neurology. Some of them are listed here, and we'll talk about a few of them in more detail. Sometimes we want to obtain some cerebrospinal fluid to test or measure the pressure of the spinal fluid, as well as inject medicines into the space. In order to do so, we perform a lumbar puncture, which you can see illustrated here. One of the best tests that we can use to diagnose seizure activity is an EEG. For an EEG, the child has electrodes placed all over their head, and we can detect the area where the spikes or bursts of electrical activity are coming from. Now we'll talk about some neuroimaging. There are many different neuroimaging modalities, and we'll compare a few here, such as the plain CAT scan, the MRI, or either with an angiogram included. A CT scan uses radiation to produce images. This is a great test to evaluate intracranial tissues and structures and look for hemorrhage, tumors, or inflammatory processes. One of the pros for CT is it's a faster test than obtaining an MRI. However, the cons include it uses radiation, which we really want to limit our exposure to in pediatrics, It also often requires IV access for the contrast, as well as requiring sedation if the child needs to hold still. You can use these links posted here to look at a normal CT for a 3-year-old child, and also look at a CT for a person with hydrocephalus. But please note, the hydrocephalus CT is not a pediatric patient. The magnetic resonance imaging, or MRI, produces a better visualization of soft tissues and image quality of really any tissues. Not only is it non-invasive, but it uses no radiation. However, the patient, if awake, will definitely require sedation, as these are longer scans. In addition, it does not visualize bone detail as well as the CT. And because it uses magnets to create the images, you cannot have any metal present in the scanner. Use this link posted here to see a normal MRI for a 3-year-old. Now we'll get into some of the basics of your neurologic assessment. You want to assess the size and shape of the head, including obtaining an accurate head circumference. This is important for the child, say, with hydrocephalus, who may have a changing head circumference that you'll need to trend. Children with open fontanelles should be assessed, as this fontanelle can give you important information about the child's neurologic status. You also want to assess their level of consciousness, which any change in level of consciousness is an early sign of issues. Your brain also controls a lot of your vital signs, so respirations and vital signs are important, and we'll talk about that more in later slides. In addition, your pupils and your eye movements are also very important. Keep in mind, we also assess reflexes, and reflexes change based on the age of the child. As we said earlier, vital signs are an essential component of the neurologic exam. There's many reasons for this, and again, we'll talk about this in the upcoming presentation. However, keep in mind that cerebral perfusion pressure, or the difference between your mean arterial pressure and your intracranial pressure, is the pressure that's actually present to provide oxygen to the brain. And in periods of critical illness or injury, we want to make sure that we're perfusing the brain well enough. The anterior fontanelle typically doesn't close until 12 to 18 months of age, making this an excellent way to help assess the neurologic status of infants. A bulging fontanelle is an important finding of meningeal irritation or increased intracranial pressure. Some of the pupillary changes that you can see are present here in this diagram. In pediatrics, the Glasgow Coma scale is age-dependent, as you can see here when you go down to the best response to auditory or visual stimulus, or the section at the bottom. For less than 2 years old, we would count different behaviors than we would for the older child.